Hey, the research is done, and Vanderbilt University says they found a direct correlation between mask mandates and hospitalizations. Reporter C.B. Cotton from Nashville breaks down the research that shows there is a way to flatten the curve in Tennessee.
COVID-19 is fought alone in a hospital room, and many survivors have come forward to share their story with us.
And my oxygen level had gotten so low.
Like the little things that matter the most.
Little things matter in the long run, according to researchers too.
We found that those hospitals that typically draw their patients from areas that currently have a mask mandate in place, we're seeing sort of a flattening of that hospitalization curve.
Data analyzed by McFeeters and a team of Vanderbilt researchers shows about 70% of the state's population is under some form of mask requirement. For people in areas not under a mask mandate and the hospitals that serve those places,
those hospitals were seeing the fastest hospitalization growth from the July to August period.
This graph shows how COVID-19 hospitalizations doubled at hospitals that serve patients mostly from areas without mask mandates. And this graph shows how COVID-19 hospitalizations grew much slower at hospitals that serve patients mostly from areas with mask mandates. This latest data builds off a previous Vanderbilt study released last week, showing that the pandemic is spreading beyond metro areas into the state's mid-sized cities and rural communities. In this latest study, researchers admit they can't say masks are the sole factor behind COVID-19 hospitalizations. Some areas have put in additional public health orders, like restricted restaurants or bars. McFeeters says mask wearing is still having a clear influence on data, and hospitals that are experiencing fast growth can become overwhelmed.
As you can imagine, if you have a really high speed of growth, it's harder to pull that back.